Good morning. My name is Toni Kay Mangskau, and I came here today from Minnesota to tell you about my family and my experience as a family caregiver. Like many of you, I am a member of the sandwich generation, providing care for elderly parents and children. As a care provider, I learned you help around the house, arrange meals on wheels, make phone calls, send emails, have in-person contact with medical providers, insurance companies, nursing home staff, group home staff, and fill out forms. All of these are typical caregiving duties. It may be surprising to some, but not to me, that as a caregiver, I have also provided much more complex care, including medication management, injections, wound care, and managing cancer treatments. It should come as no surprise to any caregiver that you are the chief explainer, you hold hands and listen, you dry the tears, and you move on. I provided this care to my dad, mom, developmentally disabled brother, adult son, and adult daughter. In 2012, my dad was diagnosed with end-stage lung and heart disease. He was oxygen dependent and had an aortic valve replacement, along with 4 stents placed. He was moved into hospice and died in 2016. My mom was diagnosed with lymphoma during this time. They actually were on adjoining nursing units. Having been married for 60 years, they had a date night every now and then. But she was undergoing cancer treatment. Currently, her oral cancer drug costs about $12,000 per month. She recently moved into an assisted care living facility, which costs about $6,000 per month. During my parents' illnesses, we had multiple visits to the emergency room, hospitalizations, and placements in a variety of care facilities. When my parents' health started to decline in 2012, I became guardian for my developmentally disabled brother. He has very complex medical issues and requires extensive care. My son was diagnosed with an inflammatory bowel disease at the age of 16. At one time, he took 22 pills a day, required methotrexate injections, and needed cortisone enemas. As a teenager, he had an ostomy and needed assistance changing the ostomy bag and providing wound care. He was bedridden for over 2 years, unable to attend high school, and was homeschooled in order to graduate. One of his recent medications averaged about $1,800 per month. With the diagnosis of Crohn's disease, his dream of attending the Air Force Academy and becoming a fighter jet pilot disappeared. My daughter struggled with chemical dependency and mental health issues since the age of 15. To access the needed treatment, I relinquished custody to the state of Minnesota. She remained a ward of the state until the age of 18. This was the toughest decision I ever had to make in my life. But due to the inequities of insurance coverage for these issues, I saw no other choice. I didn't have the $40,000 to cover the long-term treatment that she needed at the time. My daughter has been in over 10 chemical dependency treatment programs, has spent too much time in county jails and prison due to her struggles with post-traumatic stress disorder and addictions. There were many years my children were uninsured and at times homeless. With the passage of the Affordable Care Act, or Obamacare, and our state governor expanding Medicaid for single adults, my children now have health insurance instead of receiving care in emergency rooms. With the proper mental health care and surviving an overdose, my daughter now has 4 years of sobriety and serves as a peer mentor for others. I sometimes felt that providing care for them was a full-time job, but I also was working a full-time job in the medical field. Through the years, my role as a family caregiver has been a financial strain. For example, during a 9-month period in 2017, I went without 1/3 of my yearly income due to unpaid time away from work. I have declared bankruptcy in the past. I wasn't able to afford unpaid time away from work, keep a roof over our head, buy groceries, pay our utilities, and other necessary expenses along the way. Unfortunately, my family story is not uncommon. My volunteer work with the Patient Advocate Foundation, National Patient Advocate Foundation, has helped me find resources and assistance with the thousands of patients and families that I have talked with through the years. Through my interaction with patients and families, I realize so many desperately need a voice to be heard, and the Patient Advocate Foundation is that voice. Thank you.